my name is Jennifer. I'm a CVT. This is my dog Kylo, and he has dilated cardiomyopathy.
Hey Kylo! What are you doing, buddy? Okay, so Kylo has an unseen condition. Tell me about it.
So dilated cardiomyopathy is a condition of the heart. So as you can see, he's kind of acting normal. You can't tell from the outside that he has it. But it is a disease of the muscle of the heart where there's 4 chambers in the heart. The top 2 are the atrium, and they're smaller. And then there's the ventricles, which are larger. The left ventricle, which is the one that pumps really hard and pushes all the oxygenated blood throughout the body, has a very thin muscle wall, and it kind of bulges out, so it's not as efficient when it does that pump to get all the blood out. So it's kind of, sometimes it'll make them weak and stuff like that.
Poor guy. And so how did he get it? Is it genetic or?
So we're pretty sure it's genetic. There's certain breeds that are kind of prone to it, like Dobermans. And he's a rescue, but he kind of looks like he's got Doberman in him. When he's in the sunlight, he's got brown legs and little eyebrows. And so we're pretty sure it's genetic. But there are ways that dogs can get it by diet deficiencies.
Oh, well that's not good. So how did you find out about his condition?
I adopted him when he was about a year old, and about 5 months into his adoption, he was playing with a new puppy that was in the family, and he was playing pretty hard, and he started acting a little off. His gums were still pink, and he kind of like settled down for bed, so we went to bed, and I ended up waking up at 4 o'clock in the morning and found him in the corner. He was laying on his side. My other dog was kind of laying on top of him, acting very worried. So I tried to call him over, and he couldn't get up. He was very weak. His gums were super pale. He was trying to get up because he's a good boy, but he just couldn't. So we rushed him into the ER, and we found out that he was having ventricular tachycardia, where
Sorry, what does that mean, ventricular tachycardia?
So that's where the 2 bottom chambers, the ventricles, they were not pumping in sync with the atria, so it's usually like boom, boom, and they were just kind of going haywire, so the blood wasn't going anywhere. It was just kind of washing back and forth between the chambers. So that's why he got very weak. He wasn't getting oxygenated blood.
Okay. Poor little man. All right, so tell me about a typical day for Kylo. What kind of medication does he take?
So he gets medicine 4 times a day. We wake up early, give him his first set, which is all of them. He's on Mexilatine, which is an antiarrhythmic medication. He gets that 3 times a day, every 8 hours. He gets Sotalol twice a day, which is a beta blocker. He gets Pimobendin, which is an enodilator. That one is twice a day. And then he's on omega-3 fish oils. That's twice a day. So
poor kiddo. Is he pretty active? How does he deal with things with this condition?
So I try to keep him as calm as possible, but I also want him to live his life. He loves to play, he loves toys. So I'll let him play with I have 2 other dogs, I'll let them play outside. If he starts getting really riled up though, I'll slow him down, bring him inside, make him sit for a little bit. But I want him to be happy and enjoy his life. I don't want to just keep him in a cage or anything.
Yeah, it wouldn't be any fun, especially for a handsome boy like you. So, does he have a special diet? Does he kind of eat anything that he wants?
So he is on a special diet. Oh, you want to sit down? Come here.
Kylo.
Boy. So he's on a special diet. He's probably very hungry right now. He's on KD, which is for kidney and heart health. He is not on anything like grain-free, or he was just on normal dog food earlier. There's kind of a correlation between dogs getting dilated cardiomyopathy that aren't usually genetically prone and grain-free. So seeing how hard it is, to manage this condition, and it just progressively gets worse over time no matter what you do, I would really recommend just staying away from grain-free for now, unless you absolutely have to feed it for some reason, because I wouldn't wish this on anybody or any dog.
And that was the recommendation from the cardiologist, is that right?
Yes, he had me put him on KD.
So how often does he have to be examined by the cardiologist?
So he has to be examined every 6 months. He gets an echocardiogram with the cardiologist where they actually look inside of his heart. They can see how thin that muscle wall is getting with his left ventricle, and he's got a heart murmur now, so they can also keep an eye on that. Sometimes, depending on what they find, it might be paired with a Holter monitor where they have to put a heart rate monitor on his chest and monitor it over 24 hours, which sometimes is kind of nerve-wracking because that thing's really expensive.
Okay, what does his future look like?
So Kylo's future is kind of unknown. Sometimes he'll have random episodes where he was just laying on the couch and he'll start having that ventricular tachycardia, and I have to take him into the ER. So I don't really know what his future looks like. I just kind of take it day by day, make him happy, let him do what he wants, but I do, try to keep him as calm, as I can. He's either gonna one day go into a run of arrhythmias that we can't stop, or he's gonna go into congestive heart failure, which is why he's on all those meds. So I just kind of take it day by day, and I'm thankful for every day we have with him.
Oh, poor Kylo. Well, we're happy to have both you here as a technician and Kylo here as the cute, adorable, forever puppy he is. All right, thank you, Jen.
You're welcome.
So how often does he have to be examined by the cardiologist?
So every 6 months, why are you laughing? I can't do this.